Phosphorus is important because it's involved with the growth and repair of body cells and functions, as well as bone formation and loss, as it works with calcium. And sources of phosphorus include milk, cheese, yogurt, nuts, oatmeal, sardines, and asparagus. Symptoms often include fatigue, infections, mental changes, muscle weakness, and the recommendation for both males and females is 700 milligrams. Iron is involved in the transportation of oxygen to blood, and sources of iron include clams, red meat, oysters, egg yolks, salmon, tofu, raisins, and whole grains. Symptoms of an iron deficiency may include fatigue, decreased work and school performance, slow cognitive and social development during childhood, difficult maintaining body temperature, and decreased immune function and glossitis. And the recommendations, as you can see here, kind of vary based off the age, but generally females need significantly more iron than males. Iron is involved Magnesium functions to maintain normal nerve and muscle function, supports healthy immune system, as well as keeping the heartbeat regular, and helps bones remain strong. Sources of magnesium are peanuts, tofu, broccoli, spinach, Swiss chard, tomato paste, nuts, and seeds. Symptoms of deficiency may include frequent migraines, anxiety, restlessness, depression, unexplained weakness, and fatigue. And the recommendations for magnesium are 420 milligrams for males and 320 milligrams for females. Zinc functions to boost the immune system as well as preventing heart disease. Sources of zinc include oysters, red meat, poultry, fish, wheat germ, fortified cereals, and symptoms of a zinc deficiency may be an appetite loss, slower than expected growth, and poor immune system function. And recommendations for males are 11 milligrams and females 8 milligrams. Iodine is important because it is used by cells to convert food to energy, involved in normal thyroid function and production of thyroid hormones. Sources of iodine is eggs, milk, strawberries, mozzarella cheese, and cantaloupe. Symptoms of deficiency can be seen in the swelling of the neck, pregnancy-related issues, weight gain, and learning difficulties. And recommendations for adults is 150 micrograms, pregnant women 250 micrograms, and children 120 micrograms. Fluoride is important because it gives the body its shape and structure, which protects the internal organs, prevents tooth decay, and stimulates new bone formation. Sources of fluoride can be found in water, fish, and tea. Symptoms of deficiency are often weak, fragile bones, fractures, and tooth decay. Recommendations for females is 3 milligrams and males is 4 milligrams.
Copper is involved with the function of iron metabolism, immune system, and production of red blood cells. Good sources are red meat, fish, soy products, mushrooms, and sweet potatoes. Some signs of a deficiency is fatigue and weakness, frequent sickness, weak and brittle bones, problems with memory loss and learning, difficulties walking, pale skin, and even premature gray hair. The recommendation is for adults to get 900 micrograms daily and pregnant women 1,000 micrograms daily. Selenium is used for proper function of the immune system, as an antioxidant and is important for thyroid function. Some sources are fish, meat, poultry, cereals, grains, mushrooms, and asparagus. Some symptoms of deficiency is hair loss, skin and fingernail discoloration, low immunity, constant tiredness and fatigue, brain fog and difficulty concentrating, reproductive problems, and hyperthyroidism. The recommendation for adults is to get 55 micrograms a day. For pregnant women, 60 to 70 micrograms a day. Children 1 to 3 should get 20 micrograms. Children 4 to 8 should get 30, and children 9 to 13 should get 40 micrograms. Over 13, they're considered to fall into the adult category of the 55 micrograms. Manganese is known as a vasodilator. It helps increase blood flow. Some sources are liver, kidneys, wheat germ, legumes, nuts, and black teas. Some symptoms of deficiency are poor bone growth or structural defects, slow and impaired growth, low fertility, impaired glucose tolerance, abnormal metabolism of carbohydrates and fat. The recommendations are for males to get 2.3 micrograms and females in the adult range to get 1.8 micrograms. Pregnant women need to get 2.0 micrograms and 2.6 micrograms. It varies on if they are lactating or not. Children 1 to 3 should get 1.2 milligrams. 4 to 8 should get 1.5 milligrams. 9 to 13, if they are male, 1.9 milligrams, female 1.6, and 14 to 18 years old, males are recommended to get 2.2 milligrams and females 1.6 milligrams. Chromium's function is to help with insulin activity levels, maintain normal blood glucose levels. It's found in romaine lettuce, oats, black pepper, and tomatoes. Some symptoms of deficiency are poor skin health, low energy and fatigue, poor blood sugar control, weak bones and bone loss, high risk of high cholesterol and heart problems. The recommendations are for 14 to 15-year-old males, 35 micrograms, 14 to 18-year-old females, 24 micrograms, 19 to 50-year-old females, 25 micrograms, and 51 and above males, 30 micrograms, and females, 20 micrograms. Cobalt assists to take in and process B12. It assists in treating illness such as anemia. It's found in fish, nuts, broccoli, spinach, and oats. Some of the deficiencies or symptoms are pernicious anemia, hyperhomocysteine, neuropsychotic manifestations, and goiter. There is no RDA set for this, but there are some recommendations for 5 to 8 micrograms per day. Sulfur is used as more of a structural use. It helps from building the bridges and shapes and stabilize protein structures. Sources are garlic, legumes, nuts, seeds, red meat, eggs, and asparagus. Some deficiency symptoms can be fatigue, depressed mood, unhealthy hair, acne or rosacea, premature signs of aging like wrinkles, liver disease, cancer, Alzheimer's disease, autoimmune disorder, obesity. It is unknown on the recommendations of what the amount should be at this time. Choline assists in the production and release of acetylcholine, transportation and metabolism of fats. It's found in liver, egg yolks, peanuts, cauliflower, soybeans, grape juice, and cabbage. Some of the symptoms of deficiency are low energy levels and fatigue, memory loss, muscle pain, cognitive decline, damage to nerves, and insomnia. The recommendation is for males to get 550 milligrams a day and females 425 milligrams. Next, we're going to look at some herbals and some supplements. Black cohosh is an herbal that's primary use is assists in production and release of acetylcholine, transportation of metabolism of fats. Potential interactions or counter actions are that it may decrease the speed of medicines in the liver, causing some complications. Comfrey is used or can be used to apply to the skin to help treat wounds and reduce inflammation associated with sprains, broken bones, stomach issues, and bruises. It may increase the risk of liver damage, so should not be taken with other medications that affect liver, such as acetaminophen, found to cause liver damage or even death. So for Echinacea, if you take Echinacea, it might slightly reduce your chances of catching a cold. It can also slow down the breakdown of medicine in the liver and speed up caffeine breakdown. It may decrease immunosuppressants as well, so that's something you need to take into consideration when taking it. So Ephedra or ephedrine, used in combination with caffeine, had modest short-term effects on weight loss. It was eventually banned by the FDA. Contains ephedrine, alkaloids, and associated with the risk of heart attack, seizure, stroke, and sudden death. Side effects may also include anxiety, dizziness, dry mouth, headache, irritability, nausea, personality changes. Garlic is used to promote digestive health by stimulating the pancreas. It promotes intestinal health due to antibacterial strengths and fights nausea. Some of the negatives or interactions that could happen: it increases circulatory processes and enhances blood flow while simultaneously preventing blood clots. Proven to increase bile production, so adverse effects with gallstone diagnosis. Proven to interfere with the absorption of iron and fat-soluble vitamins. Ginkgo biloba may help to slightly improve some symptoms of dementia. It may decrease effects of alprazolam and efavirenz. Slow blood clotting and increased risk of bruising and bleeding with ibuprofen and warfarin have been seen. It may affect insulin levels. It may affect chemicals in the brain when taken with anticonvulsants or trazodone. It may decrease the speed of which the liver breaks down other medications. Ginseng may prevent upper airway infection, cold and flu symptoms, and may help lower blood glucose levels and reduce blood pressure. It may also decrease the effectiveness of warfarin, increasing risk of blood clots as well. Kava has been used to help reduce anxiety. It can cause drowsiness and sleeplessness when taken with an alprazolam or CNS depressants. It may decrease how quickly the liver breaks down other medications as well. Milk thistle may help individuals with liver disease, chronic hepatitis C, and diabetes. It may decrease how quickly the liver breaks down other medications. It can decrease effectiveness of gluconated medicines. It can increase the amount tamoxifen absorbed in the body. Red yeast rice contains monocolin K, the same ingredient used in lovastatin, which decreases cholesterol. Some adverse effects or some interactions could be the interaction with alcohol, immunosuppressants, grapefruit, other cholesterol medications, niacin, St. John's wort, and statins. Should not be taken before or during pregnancy. St. John's wort is used primarily as an antidepressant for mild or moderate depression, menopausal symptoms, and wound healing. It can increase the rate the body breaks down cyclosporin, decrease effects of digoxin, increase serotonin to high